as per the custom, okay, so let me warn you that we are going to be live recorded, both audio and video. Please keep an eye on your laptop. It may fall under the camera. Okay, so can we start the recording, please? So as usual, we will start by introducing ourselves, even though we might have known everyone or almost everyone. So I am Councillor Paul Egil-Shelvan, chairing this meeting, Councillor for Cramlington South East.
Good morning, I'm Graham Sayers, Doctorate.
Morning everyone, Jill O'Neill, Executive Director, Public Health, NCC.
Veronica Jones, County Councillor and Portfolio Holder for Improving Public Health and Tackling Inequalities.
Good morning, everybody. I'm Kevin Warren, Police Superintendent for Northumberland.
Morning, everyone. I'm Graham Binning. I'm the Chief Fire Officer at Northumberland Fire and Rescue Service.
Good morning. I'm Rachel Mitchison, Director of Delivery for Northumberland and North Tyneside for the Integrated Care Board.
Good morning. Peter Stanfield. I'm the Chair of Health Watch Northumberland.
I'm Derry Nugent, the Project Coordinator at Health Watch Northumberland.
Hi everyone, Neil Bradley, Executive Director for Adults at the Council.
Good morning everyone, I'm Jeff Watson and I'm the County Councillor for Amble West with Warkworth and also the Cabinet Member for Healthy Lives.
Morning everyone, I'm Nicola Duffy, I'm Programme Director for Thriving Together and we're commissioned as the Voluntary and Community Sector Support and part of Citizens Advice Northumberland, and I'm here on behalf of Abby Conway.
Good morning, I'm Graham Wright, Director for Children, Young People and Families here at the Council.
Morning everyone, I'm Ashley Easton, I'm the General Manager for the North 19 Service in Gateshead and Northumberland, and I'm here representing Russell Nightingale.
Morning everybody, I'm Mark Purvis, I'm the County Councillor for the College Ward in Asherton.
Morning, I'm Chloe Mann, I'm the Police Director from CNTW.
Hi, good morning. Siobhan Brown, Director of Women's Health at the Integrated Care Board.
Andrea Todd, Democratic Services.
Apologies for absence. Any?
Chair, I have apologies from Victoria McFarlane-Reid, Hilary Snowden, Russell Nightingale and Abby Conway.
Thank you. Second item, the minutes in front of us. Can I propose that we pass it as a true record of what happened on 11th July? Thank you.
Can I just say my apologies weren't noted?
Oh.
And I think I did send apologies.
Right, okay, we will note that definitely. Any disclosures of interest given the items today? Thank you. There's none. So we go on to the first major item, item number 4 here, Women's Health Strategy Update. That will be given by Siobhan here. And thank you for presenting the report here today. And may I note that this is for the whole of ICB, right? So I would like the discussions after that to be focused on Northumberland and also to be focused mostly on the causes of inequalities, how we can deal with it. Okay, thank you. Siobhan, it's yours.
Thank you very much, Chair. I do have a presentation. Is it coming up now? That's great. So the first two things that I want to say today is that it's very much about the health and well-being of all women and girls, not just the healthcare of women and girls. I think that's really important, and we'll come back to that. And the second thing is that local authority footprints like Northumberland are where communities live and where the work happens. And I think what we've got to think a lot about, and we can have a conversation about this, is what's best always done at place and at community level, and what can something like the Integrated Care Board add that's a really good value on top of that. So just to give you a quick rundown of why we're here and where we've got to. In August 2022, first ever Women's Health Strategy was published, and we also had an appointment of a Women's Health Ambassador, Dame Leslie Regan, who's a formidable character, and I think will be addressing the new Secretary of State for Health and Social Care as we speak around this. So she's a real champion for this. And 25 million was made available nationally for this. We got 600,000 for our patch, covering 3.2 million people. It wasn't on fair share. It was for everybody to have a go regardless of the size of the ICB. We did challenge that, but it was what it was. So that money is now in the system, and that money is being used for some hub developments. Later on, and I know Healthwatch are very involved in this, there's a big piece of work going on about a conversation, really honest conversation about this space. So where we've come to, there's an incredible, for those of you who are interested, we can share this with you. There's a really good data profile for the whole of our patch plus Northumberland, sliced by all local authority areas, that makes really powerful reading. And on top of that, there's a needs assessment done, which again is very, very powerful, and we'll come to some of the inequalities and challenges that we've got. What's starting to happen is a coalescing around some key priorities. And these are, and I'll go through them in a little bit more detail in a minute, are things around long-acting reversible contraception and access to postnatal contraception for women, the menopause in its entirety, the prevention and early detection of cancer, and I'll come to that because in our area, cancer is the biggest killer of women, even higher than CVD, which is the national biggest killer of women. And again, testing at these women's health hubs. So in our patch right now, we've got 3 different models going. We've got a single point of access model, we've got a hub and spoke model, and we've got a virtual. So I'll talk you through some of those. But I think the most important thing to say is those hubs are currently in Gateshead, North Cumbria and Sunderland. But actually what matters is every area. And the last thing we want to do is create inequalities by putting in pilots like this. The whole point of this is scaling up what works and looking at expansion of hubs to other areas, and we'll come to that as well. There are other areas in the plan, and there's something about trying to tackle some things really well rather than doing everything to a lesser level. But we must never forget the mental health and well-being, and basically that runs through every single theme that are related to women and girls, and other menstrual and gynecological conditions, and fertility, pregnancy, maternity and loss. And also there's a whole area of work which we're all involved in now, which is around living and ageing well and living with long-term conditions. And a really important area as well about the impact of violence against women and girls. So when we looked at this, what we found and what the evidence was telling us was that we've got to get the foundations right, and I'll show you some data, and I'll share some data with you in a moment, that things that you might assume are in place are just not. So, for example, equal access, easy access to core services like long-acting reversible contraception is just not available across the patch in an equal way at all. Neither is access to postnatal contraception, for example. So there's something about getting the core services right at a foundation level, so that as a whole North East and North Cumbria system, we can say wherever you are a woman in our system, you have that access. So I think that's something about what the value add is at a system level that we can think about. But at the same time, there's incredible areas of ambition and innovation, and I'm sure you've got brilliant examples of that in Northumberland as well. So one of the things that we're looking at is very much about the delivery of long-acting reversible contraception. And this area of work is very entwined with councils. And there are areas like Liverpool where they've managed to sort out the Section 256s, Section 75s, in relation to this, to give holistic access across the whole piece in core services to this, and we're learning from that. And there's a really good return on investment for this. I'll come to some data on this, but our abortion rates are very, very high, and access to LARC, which it's called, during COVID dropped significantly. So there's some things that we just need to get right. And on top of that, there's something very much about other core services for women around prolapse and pessaries and other services like that that currently get delivered a lot within gynecology in secondary care settings, but are really perfect for primary and community settings. So the other part about looking at the contraception is that's kind of one of the things that you could do within hubs, but later we'll come to a bit of the debate about continuity of care within services versus coalescing things within hub environments. From a menopause perspective, of course, this is a really big topic nationally, and there's a lot of work now on policy that we will implement across all workplaces and work with people to do that. And getting people trained to work with menopause and using that make every contact count around menopause. And again, return on investment in this space has huge potential, because sometimes women are having 6 to 8 appointments over a long period of time, where if you could manage to get some kind of holistic assessment and their needs met, that would reduce significantly demand in other places. There's also things like menopause when you've got cancer and other kinds of areas that we really need to look at around this. From a cancer perspective, I mentioned it is the leading killer of women in the northeast, and areas that we're particularly looking at are around targeted lung health checks. But to give you an example of inequality in this space as well, cervical screening rates vary dramatically across all of our footprints, from 89% take-up in some areas down to 35% in others. That's an incredible inequality that we seriously need to address. And another really big priority for cancer is really catching people in stages 1 and 2. Early detection will mean longer lives, and longer lives not in ill health. And women in the northeast spend about 21 years in ill health. And people say, yeah, men die earlier, and they do, but women do live with ill health for a much longer period. And again, there's some tangible actions that we're looking at very strongly around these that are in the implementation plan that we've got. And from a women's health hub perspective, just coming on to these, Sunderland model is very much around looking at deprived communities. It's led mainly from the primary care settings, and it is up and running now and delivers a variety of holistic models of care. One of the debates I think we do need to have around this is how much of these skills and training do we want to embed in all of our primary care settings within Northumberland and community settings versus having hubs, and how do you get that balance, that sweet spot between hubs and what they do, but not de-skilling in other settings. And I just wanted to give you an example. Tower Hamlets down in London have had their hub up and running for a while. They also have a single point of access where they triage all areas, and they get about 1,100 people through that in a month. So just to give you a sense of tangibility, so before the hub was there and the direction from this place, 85% of all women's cases were going to secondary care gynecology. Once this hub's been up and running, that's dropped down to 25% going to secondary gynecology. The advice and guidance given to primary care has risen substantially, and the amount of women seen and holistically dealt with within the hubs is really phenomenal. It's like a game changer. But in terms of offer to primary care, because the last thing we want to do is de-skill primary care. There's also an offer that primary care have that advice and guidance, can attend or shadow any of the clinics that are going on, and also can grow skills within practice. And when you come to things like, you think these things are easy, but they're actually quite complex to deliver, and we've got to unblock it. For example, around long-acting reversible contraception, there's coils and implants in that. What you find is there's people who get trained but then don't use the skills or can't access training, but we need it. So there's something about how many do we need of those fitters across our patches that gets the right economies of scale but keeps skills locally. And I'm not saying I've got the answer to those, but those are the kinds of things that we really need to debate. And voluntary and community sector, I think one of the learning things that's coming out of hubs is really, it's just an incredible space for that and social prescribing and all of those services that come with us. I wanted to just share with you some national direction of travel to give you a sense of how we're fitting in the national picture. And for the first time, there's been a national clinical director appointed. She's called Dr. Sue Mann. And she also runs some hubs down in London as well. We're still waiting to hear what the government has to say on this. What we are hoping is that there's a fair wind. We're hoping that there might be more funding on this, but we certainly are hoping that around the inequalities agenda that there is, and we're kind of bearing that in mind as we build plans. And we'd like you to think about that locally too. And you'll all know this principle about pulling people out of rivers and that whole focus on treatment that we've got. And actually, we need to get up that river, upstream, and do the work there. And we know that. And there's something in this whole space around women's health, around self-management, low risk, keeping people really well. But then when people do need the care, they get it in the right places. And that's, for us, a lot of that is in primary and community settings. And lots of this as well is about the patient and lived experience, and not just patients, about women and communities living really well and thriving within their environments in the centre of families. But what we are finding is that people are all along the spectrums from of their health, right from things like pelvic pain, endometriosis, issues around preconception, incontinence, menopause, and it's about getting people the right care at the right time through all of that. So there's something about how we build that interface, right the way from the prevention end of it to when people need more specialist services. And one of the things that Sue Mann talks about is how do you know, what does success look like? So we're really focused on the evaluation of all of this in terms of really trying to reduce unplanned pregnancies, really trying to reduce the space between pregnancies, increase the space between pregnancies, and really listening to the lived experience of women. And then in terms of outcomes, I've shared with you some of them around cancer, but there's many others out there in the system. And as women are ageing, the issues around frailty, falling, bone health, all of those come into play as well. And there are also some strange anomalies in terms of access to things like hormone replacement therapy. What we find is in some of the least deprived areas is quite a high uptake of that. In the lower areas of higher deprivation, very low uptake, but really high uptakes of antidepressants. So we're going to do some work on that to find out what's going on and making sure we're treating the right things. And I just wanted to raise this, that there is a big conversation going on about having real conversations about what matters to women that constantly informs this debate. But I think one of the most challenging things we've got on the table is how do we unlock some of that funding in the secondary care system into this space to really get that return on investment, but even more importantly, that experience of access and outcomes for women. So that's it, Chair, and I'm very happy to take comments or questions.
Thank you, Siobhan. Thank you very much. It was very succinct and informative as well. Thank you. Any questions, please? Yeah, Jeff.
I noticed you were talking about take-up And here, it's always something that I've always seen in Northumberland. We've got various areas of deprivation, and I've got areas where there's less deprivation. But the take-up in the areas of deprivation, as you pointed out, is very low. I've never understood that, because they are geographically rather a tight area, so it's not about geography. And the areas where there's less deprivation are big geographical areas, but they take it up much better, and I'm puzzled by that. I haven't got an answer. I don't know why. I just don't know why. Does anybody else know why?
Do you want me to start, Siobhan? So a lot of this is to do with people's health behaviours and their perceptions of health and their attitude to health, in the sense of being having a sense of quite a stoic attitude sometimes, and almost unfortunately accepting their ill health condition and making do. There's also something about awareness and confidence to be able to access services, and it's about how, from a literacy perspective, we ensure our ability to explain the benefits of coming forward for a screening programme or for their immunisations are of relevance to that individual person. So it's not only about the physical presence of a service being available, it's that acceptability of that service for people to feel that it's for them and that they can come forward and access it. So it's wrapped up in a lot of cultural and support mechanisms, and how we can encourage people to step through the threshold of that door to be able to access that service, and how we also understand the nuances, so that it's not always about people coming to a service, how we can do outreach into communities as well.
So that's our job then?
Absolutely,
That's
our job as a
responsibility.
collective.
As a group, it's our job to do that.
Absolutely, we shouldn't just assume people will come through that door.
Thank you.
Yes.
Thanks, Siobhan. Really thought-provoking, this. First, I'm going to declare a conflict of interest. I am a man. And then I'm going to just acknowledge, internally, this makes me feel uncomfortable, and I was trying to understand why it made me feel uncomfortable. And I think it's probably because I've got unconscious bias to do with my culture and background that means that, is this a health problem? It is kind of, and quite blatantly it is, because Jill's also given me some data about some of the inequalities between women's health and other things in here, and it makes really start reading. So there's something here that means that we're all behaving in an automatic way as reasonable people, and yet somehow we are disadvantaging 50% of our society, I think. So it's a really good debate to have. And then I was thinking, right, who in the room has a hand to play in this? And I think we've just covered it, we all do, but I was thinking, right, okay, so Kevin, domestic violence, police force, there's something there. Voluntary sector, all the people you see that we don't see in health that actually are victims of this, that's not the right word, I don't think, but maybe it is, don't know. I'm thinking Harrogate, all the young mothers you see and all the roles that you could have in this, and I'm thinking Chloe and mental health. And then I thought, where is our coordinated response to this as a system for Northumberland? And I was thinking, Rachel, I have a gap because I'm not quite sure who is leading from our perspective for Northumberland on women's health. And then I'm thinking, right, so we need to take this to our STB and operationally decide how are we dealing with this. So that was kind of my thoughts, but I'm really love to hear from some, and Rachel especially. Okay, thank you.
Yes, please. Yeah, Rachel.
Thanks, Graham. I think that is really important. So I was lucky enough to go to the conference, and it was very inspiring. And I get what you're saying. And actually, I did take that away and think, what are we doing locally? Now there is lots going on locally. So we have some really good work with public health, and we are really aligning our commissioning around things like the LARCs, as we've talked about. There's some work around cancer, but it isn't particularly coordinated. So there is a member of the team who is our women's health lead, which is Tara Trigg-Robson, and she's really passionate about it. She went to the conference, and I think one of the actions we should take from today is to set that steering group up, which is what she's looking to do, so that we could actually pull all of that work together and actually ask our partners to attend. So we could take a proposal through to System Transformation Board, set the work up, and then come back here with the sort of progress. But I think we need to map out what we're doing and where we need to go to next, but very, very happy to take that forward.
Yeah, thank you. I mean, I think Graham talked about coordination, and you also acknowledge we need to make a coordinated effort and focus. And I think in your presentation you said Liverpool is kind of doing very well in this aspect, and their abortion rate is very low. Is it one of the best practices? The coordination and focus is one of the best practices we are learning from
It definitely is, and you know, we're happy to connect you with them, and we're learning from them because they've managed literally across huge swathes of Liverpool to have sorted the lark, and also things like doing pessaries and core services. But not only that, they've managed to get return on investment to release funding. So let's learn from them. And I'm very happy to connect you to them. And they're so supportive. Likewise, Tower Hamlets with their work.
Yes, Derry, please.
Thank you, Siobhan. That was really, really great presentation. And I think it shows so much of what's going on. But I suppose that's my next question, because there is already so much going on, but the big conversation is also going on. So what is it that you are expecting to hear from the big conversation? What do you think of those 5 questions that women are being asked that's going to come back? And how will that then influence what is already a programme that is in progress? So, yeah, how's your public engagement around this going to work?
So I think a few things on that. I think one is it's about getting away from rhetoric to real conversations and real lives, frankly. I think that's part of it. And also making sure that lived experience actually informs the design of the work that you do. So there's that. And Graham, I was reflecting on your honesty about where you feel in the system about this, because for me, men are one of the biggest allies we've got in this. So for me, the big conversations are about that wider piece, because when I go and present on this, I get kind of 3 reactions. I get, really? Have we not sorted this? And others going, yeah, we've sorted this, and others who feel quite uncomfortable that we're in this position. So in terms of big conversations, I think that it's an honesty piece to call things out more, but then also to keep that conversation and lived experience really close to the design going forward. So there's that bit for me. Yeah.
Any more? Yes, Peter. Yeah.
So linked to that, actually, the big conversation, I'm just interested in whether you have a feel yet, get that it's still going on, but do you have a feel yet for how the reach has worked out? Are you reaching the kind of audience you were hoping to? How's the uptake and where are you landing it?
I think we'll need to do a check. It's early days on it, but let's do a check. But I imagine we're not. I imagine we'll take a look at that and then look at where else we need to reach. The other part of it is that from a local perspective, the last thing we want to do is override local mechanisms for engagement, which is why we're working with Healthwatch on that, because you have your natural local mechanisms for that. And the last thing we want to do is override, duplicate or miss something. So there's that. And the other part for me is, if you take things like we mentioned domestic violence there, I know how much work goes on in local systems on that, both in terms of our statutory responsibilities around it, but the wider wrap-up support. So the last thing we want to do at a system level is interfere with that, because it works really well. What we're trying to look at is, what can an ICB, the biggest in the country, have some sense of power over to either advocate or change as a whole system? And that's kind of part of the difference we're looking for as well.
Yes, Kevin, please.
Thank you very much, Siobhan. That was really, really interesting and really positive, the plan. I think from a policing perspective, as Graham said, we do have a very, very big role to play in this. And again, we have a lot of men in the police. And it's about raising that awareness, and we do go a lot of domestic violence, sexual violence, assault type cases, and I think every contact we have with women in Northumberland is an opportunity to raise awareness and that referral in for access and how to get the support, particularly in our most vulnerable and hard to reach. If there's anything we can do to support that, and I get there's the system around domestic abuse and the complexities, but every contact we have is an opportunity, because victims do disclose other things within reports of violence that we may then be able to signpost. So that signposting process could be improved, perhaps from a policing point of view, into all these other services. So if there's anything we can do, just share it with us and we'll share it in through our processes.
Thank you, that's brilliant.
That is really appreciated. Thank you, Kevin. Thank you very much. Are there any other questions, suggestions?
think,
Yes, please.
I think for me it's about potentially having a little bit of a catch-up outside of this meeting and looking at how, you know, as the 0 to 19 service going out there into women's homes that we could support with your local conversations, but also we gather a huge amount of service user feedback and, you know, in terms of influence and moving forward, there may be things that we could share as well.
Okay, yes.
Thank you. A couple of comments, if I may. You'll recall that when we talk about inequalities, we refer to the 4 domains of inequality. So actually, it's important that we know there's inequalities within inequalities of this information that we're talking about today, and it touches on your point, Jeff, very much so. Because if you're a woman in poverty, in a rural area, and a carer, and that isn't an unusual circumstance, then you are either further able to access these kind of services that we want to make accessible. So I think the key point is us understanding the diversity of our female population. And actually, we talk a lot about the healthy life expectancy gap of 17 years. That's both male and female. It's actually 21 years female healthy life expectancy gap within Northumberland, because of the compounding factors. And when we look at the economic activity of our females, 30% of our females in Northumberland are economically inactive, mostly to do with childcare. So how do we change our systems as anchor institutions? And it's all back to the basics of what can we do to enable and empower our females to be able to work flexibly, to be able to access support. Good, obviously all the work we're doing with family hubs and the childcare offer will make differences in that. And I also just want to highlight on the forward plan coming later in the year is our sexual health strategy. And we are doing a lot of work in relation to understanding the diversity of access in relation to LARCs, contraception. But we've, in public health, and it might be something for ICB and other colleagues to consider, we're wrapping into all of our service specifications a requirement to undertake a health equity audit. So that is understanding what data we capture, because we don't know, we can't measure something if we don't ask the question in the first place. And our data isn't always as good as it could be. So if we have the health equity audit built into our service specifications, that's about who's accessing something now compared to our demographic profile. So are we representative of our population is the question that we can then do much more targeted service tracking and delivery and the nuances that are required for the diversity of our population. So a couple of reflections, and we are doing a lot of work, but it's about bringing it all together, isn't it? So thank you.
Thank you. Any other? Graham. Yeah, Graham, yes.
Yeah, just not to reiterate other people's points, but I think as senior leaders on this board, as I will regularly remind us, and I think Kevin's captured his thoughts perfectly, do we genuinely take away, if we are part of a whole systems approach to things, and this alongside many other priorities that we should be considering, are we truly taking back to policy review, making every contact count? Because that's the thread that goes through all of this. I'm also projecting forward to October of this year, following our last inequalities event, with a focus around housing. So what's the support around local authority and social landlord housing, around the making every contact count, making every connection count? And from one connection, we may not always have the solution, but the strength of our weak ties as we join the dots of other services. And for those of you who were at the inequalities event, my challenge was, tell me something I don't know. There are so many services out there that can connect to other services. So just that wider point of, are we genuinely, I challenge the board, are we genuinely taking back to our policy review our commitment to making every contact count?
Yes. Go ahead.
Thanks, Graham. Building on that a little bit, making every contact count always to me feels quite a reactive response to solving a problem. We wait until we have a contact and then we identify that this person would benefit from a wider response from us. When Jill listed those 4 criteria that she had in her mind about somebody who may be at a greater risk of an inequality, it made me think, well, where's the button on the computer that on our database of Northumberland just gives me a list of all the people who were deemed in a rural population who have been a victim of domestic abuse, and there's criteria that if we had the data analyst correct, we could just produce a list of the people who we think might need some kind of specific action to bring them forward. Do you see what I mean? And at the minute, we haven't got that degree of data analysis. That's called it's a population health management way of identifying people who we think we should. And Jill and I have discussed this in some depth, and we have got thoughts on how it might work. But it's a really tough nut to crack, because you have to have the power to mix the data in and then have somebody who's clever enough to drag it out for us. And we're just not quite there with that, but it could make us far more effective and focus our resources truly where they're needed.
So if I may ask, Graham, so the population health management is collecting all the data. Is that?
Population health management is just a term to say that there are ways of identifying people within our population by using data sets who we could focus resource in some way to create a greater difference for the people who truly need our resource the most.
I might trailer Emma slightly, because I think there's going to, sorry Emma, I'm not putting you on the spot for the next session, but we do use a tool called Low Income Family Tracker, and that we are starting to build data, as Graham suggests. But the Holy Grail is how we data link the NHS data with the local authority data to create that vulnerability list, which would enable us to more proactively reach out to target core parts of the community, rather than do this blanket approach, which we know does not work.
Yeah.
David, just to come back on your point, Graham, and I think it's a very, very real challenge to come back to consider, are we seeing making every contact count as a preventative measure, as a proactive, as an upstream mechanism? And that's my challenge, because that's where I see it. And Jill's just stolen my thunder, because I was going to talk about the financial wellbeing paper that's also coming through today, what work we are doing as a fire and rescue service with regards to the low income family tracker, what that means when my staff walk through someone's front door. We can tell them about smoke detectors and a nighttime routine, but actually, if we could become a sum of our skills to know about early onset dementia, signs of falls and frailty and elderly, and actually maybe something around someone who may benefit from a low income family tracker assessment, and actually start to nudge them forward with an ability to know that there's some benefits out there for them. So again, I'll challenge the board. What are we doing to genuinely see making every contact count, not as a reactive measure?
Yeah. Thank you. Yes. Well, I'm coming. Yeah, I agree with you. I mean, the MECC scheme is a very good setup. So to gather information and intelligence about this one. So how we take the information act on is very important. Yeah. Yeah. Yes, Peter. Thank you.
Thank you, and thank you, Graham, for raising that. The risk of trailing our own presentation as well, and apologies to Emma, who hasn't had a chance to say this yet either. This is fundamental, isn't it, to what we're trying to do here, just bringing these connections is fantastic. I love your tree diagram in your paper. It's really good. And the relationships we've got across the board here, across the organisations that we work together with, have laid a very strong foundation. I think a mindset that says let's make every contact count is part of that foundation that underlies that. If we can get that strong root system in place, then we can start to think about it as part of a firm infrastructure rather than a completely reactive approach to. But it is fundamental that we recognise all the contacts we've got. It's quite sobering to think that all of that data can help us identify communities of interest, experience, and all those other things I keep harping on about. I'm sorry to sound like a broken record, but isn't it sobering to think that we've got a community of experience in women, 51% of our population, and we're struggling to hear what they're actually trying to tell us? We'll come back to that.
Thank you. Yes, please.
Thank you, Chair. Jill, you mentioned getting people to the door for assistance. Siobhan, who would be waiting behind that door?
So I think it's not necessarily getting them to our door. It might be us going to their door. And I think it could be a combination. So if you take the Sunderland example, they've looked at their ethnic groups, BAME communities, and are creating kind of mobile answers to that. And what they do is they sit down with those groups of women and go, what would make you come to something, or how can we come to you and meet you where you're at? in terms of getting access to these services. And I think the people who could be behind that door or that service going out will be a combination of health, but voluntary, social, because we all know that unless people have work, have money, have education, then, you know, the treatment bit can only do so much. So I think behind that door or that mobile offer would be some kind of holistic model based on what the women tell us they want.
Thank you.
Thank you. Anything else? Okay, can I close it? Thank you very much, Siobhan. Thank you. Wonderful. All right. Yeah. The next item is financial well-being, to be presented by Emma Richardson, but it will be introduced by Veronica first.
Thank you, Paul. I mean, if you'd have glanced at the agenda for today, you'd have seen two entirely different reports coming to this meeting, and yet, as we've heard, they've sort of linked together in all sorts of ways, and it just shows how we just do need to look across the whole thing at everything we look at. This report was already planned to come to the board today, but it's very timely that we've got an update following the national announcements regarding changes to the winter fuel allowance, so I'm really pleased we've got this here. Financial wellbeing is part of our Tackling Inequalities plan, and the purpose of this report is an update on the financial wellbeing work, which is linked to the poverty and hardship plan that we've had for the last couple of years. The Money and Pensions Service defines, I'm going to read this, defines financial well-being as feeling secure, in control of your finances, both now and in the future. It's known you can pay your bills today, you can deal with the unexpected, and are on track for a healthy financial future. And I think that really sums up what financial well-being feels to all of us, I think. The network is our sustainable way of ensuring all parts of our local system are joined up and to improve the financial well-being of our residents. So I think, well, I think we all are looking forward to hearing from Emma on this important update as to where we are, particularly in our campaigns to help our residents maximise benefits. Free school meals and the pension credits are important, and particularly how we're using data tools to get our best outcomes. So thank you, Emma. Off you go.
Okay. So I don't need to read the quotes, and I probably won't read from the slides, but as you say, the MAPS definition is quite helpful and also quite ambitious. Actually, I think it's not a low bar for any of us. I've also added in there the quote from our own DPH annual report to show just the prioritisation. There's a whole section in there as well that's worth a little look. And a bit of data that just kind of pulls it into context for how we live in terms of having savings in the bank. So if you think about less than £100, that's not even a car return or a car repair or a weekly shop. Borrowing money on credit to pay for bills, and people not knowing enough to plan for their retirement or just coping with the day-to-day, and especially a concern for us in Northumberland. And also, where are we starting with children and young people getting a meaningful financial education in a real-world setting? Because frankly, finances are so different now than they were even when the curriculum was set. We really need to understand that a bit better. And just in bold there is the correlation, and we've talked about that. Siobhan mentioned that this runs through all of our day-to-day lives in so many ways, and is a key enabler for people to be well and live a good life. So it has to be a core priority. I did mention in the report that financial wellbeing work is picked up in so many different ways, colleagues in children's, in the fire service and others, and this kind of brings threads together, and the network is a really important part of that, so we have sight of what we're each doing so that we can all work together to the greatest effect. So by no means is this a complete package of everything that is happening in Northumberland. There's much more at a micro level and at a macro level. Some local data just in there around Citizens Advice managing more than £6 million of debt, and also the deficit budget, which is a real concern, where just the income that comes in, even on the best day, on payday, does not cover the 4 weeks and 2 days that follow, and that's causing people to have those actions above it, borrowing to pay for food and so on. So in Northumberland, our key approach in financial well-being, obviously at the moment there is still a degree of hardship support that we're involved in, but what we're pushing towards is joining that together to build in with resilience. And then we've got the income building. We mentioned the maximising the entitlements and the benefits that people have, ensuring people are paid the right wages and so on and so forth. And then on the third is that place-based resilience, and we've talked a little bit about MEC, sharing information, working in partnership, and really just getting underneath all of those, making sure every single contact counts, not just at individual level, but also at partner and organisation level. So we're all coming away with more information and more resilience building that we can take back to our respective network and places. I've cited the money and pensions strategy for wellbeing because actually it's a really firm document and it's helpful, and it comes with a series of tools, of assessments that we can do to see where we are. And it's summarised in those 3 areas, those foundations, that day-to-day life and looking ahead. And you can see those 5 areas that's tied into, and they do put some significant measures against that are helpful for us. And going forward, it is important that we're measuring our progress against what we're doing. We've been in a bit of firefighting phase with the last sort of 4 or 5 years, things that have been going on with the pandemic and then the cost of living crisis. But we're readied now. We've got strong partnerships that have been built out of necessity through those periods, to be fair, to start seeing, right, what are we doing about each of these different aspects? And you can see that meaningful financial education, encouraging savings, how are we ensuring we're building those buffers in for people's lives, managing credit. Credit is important, but it needs to be used for what it needs to be used for and not for paying day-to-day bills. Access to good, reliable debt advice soon, and that's a bit like as to Siobhan's point, where is that and when is it? How are these things available to people earliest moment, so there's not a whole load of unpacking of crisis before we get anywhere. That looks like resilience. And future planning for well-being, pensions are a thing that we all need to be thinking about. We're in a changing world, we're living longer in lots of good ways. How is that going to, what can we do? What's our role as a partnership and as a local authority and as places and people and connections to be working that? And that also includes the wider well-being about where people go and how they live, and not just the advice, but where are they going for it? We've got our community hubs where citizens' advice are sitting in, and our family hubs, there's finance, and there's a social element which ties it right round into that well-being, which is, as Councillor Jones says, is how it all joins up and makes sense. When you see the agenda, they seem quite distinct, and then when you start talking, they're really not. So we've touched on the financial wellbeing network, and that really is about drawing groups together and organisations or anybody who is in this space to make sure that, one, we're sharing what we know and what we can do and resources where it makes sense, but that we're also working towards those ambitions together. That's chaired by the 3 kind of key players in this work, which is NCC, Citizens Advice and the Northumberland Community Bank, who are a strong asset for us moving forward with this work. And it's really important that we're developing together because there's more, it goes further, the impact is greater. Sharing that understanding while uncovering the opportunities to work to greater effect, which I think we see more and more of, which is excellent. I mean, even you hear the energy as we're talking about the different pieces of work and the commitment from different people in the room to see we can get together and do a bit of that. That's my bit of the jigsaw. Cascading the valuable information, agreeing this information across, this is what we've got, this is how it works, and then taking it away to use within our own networks. And I've mentioned key ones there, which would be the faith leaders. We know our faith spaces and places are so important in Northumberland, especially in some of our rural communities, but it is where people congregate, and I'll come down to the age factor to that as well. The warm spaces and places are real mixed. Anybody who's opening their door, putting the kettle on, how does the financial wellbeing network serve these places to make sure that somebody who comes in and says, I'm a bit worried about this winter coming on after what I've heard, how do we make sure the information is good and in place? And then, of course, the Children and Young People Network. You've seen me here before talking about the holiday activities and food programme and other things. This is great reach into places who have good conversations with families and children, so the network has a key role in that. The work plan for the last year was around that information sharing and looking at that clear pathway for credit, debt and hardship, developments of simple assets, and supporting, of course, Healthwatch's excellent financial wellbeing leaflet, and just to, again, making sure these are in places where people can pick it up in the moment they need it and react so things don't get worse. Going into this year, we're looking at that income maximisation, which I'm going to talk about a bit more, and some early mapping with public health colleagues on meaningful financial education. What does that look like at the moment in Northumberland? There's opportunities around the new wraparound day with the school. What might we want to programme in and around what's in family hubs? How are we putting that in place in a way that does have the desired impact? Just some logos here around the Financial Wellbeing Network, just so you can see the reach of that. And if you imagine across that, even those partnerships on those logos there, we're touching a lot of our families and communities and residents with those partners that are there. And that's an open door. So if somebody is interested working in that space, even if they have one small group on a Tuesday, but seem to absolutely come along and be part of that conversation and help us really develop and share those messages. So we talked about hardship support being tied to prevention. Increasingly, when anybody gets in touch with us, and I say us as a system, for some hardship support, working really hard based on what we've learned in network and partnership working to build prevention into that, working with anybody and everybody we can to say, how do we do this? What's your conversation look like? And it's a bit like MEC, that soonest point into your challenge, Graham. How is it on our lips? How do we talk about this gently and appropriately in our settings? Maximising incomes at the point of support by understanding how we unblock entitlements. That's a really important thing, you know, pension credit, attendance allowance, free school meals and things like that. Simple to apply for, wide eligibility. How do we make sure that's visible to the person who's maybe working the urn at the coffee morning after the church service on a Sunday? Is there a poster just behind thinking that through? Because these are quite transformational moments, and getting it right then can prevent that using the debt, the credit and so on. Our energy pathway, which we've spoken about here before, also has got a strong focus on energy efficiency and carbon reduction, all of which aids financial well-being, developing of the leaflets I've talked about, and signposting. When we've got an opportunity, if there's a space, can we put something on it? So if there's an envelope going out around council tax, we used to put a leaflet in, and then we thought, we were advised by the network, not everybody opens the letters. Can we have it on the outside of the envelope? And see, you know, it's those things, those bits of information, but like I say, it's sitting there on your counter, and it's, if you're struggling, you can give us a call, and you haven't had to look at the scary information inside. I mentioned Northumberland Frontline. Again, you'll be aware of this. It's a simple referral tool, and that has, when you put in financial, house to help with bills, whatever, it will bring up organisations that are able to, and you can do a simple handhold. It is a growing and organic, the numbers are on there. But again, going back to the network, it's one of the networks that the information then gets shared to via Frontline. So even the ones you might think, well, I don't really know what the gardening club in Hexham has got to do with financial well-being, but if you've got simple assets you can share with them, and they just pop them up on the day that they we don't know the impact of that, but it's really important, and also for that direct referral for support. Income maximisation. You may have seen the report that was done by Carbon and Policy in Practice to show 1.3 billion of unclaimed benefits and entitlements in the North East, which is a staggering amount of Northumberland pounds, is a good percentage of that. And in Northumberland we have the low income family tracker tool, which has been cited before in this session as well. And that combines the local authority data with social policy to tell us, you know, the financial well-being mapping, what's going on in communities and the potential entitlements. I always use data-led rather than data-driven, because data is only as good as it is, and I think, Jill, you alluded to the fact that, you know, we need to keep working on our data, but what it absolutely tells us is where we should be deploying resource, where we should be reaching, and how we can then demonstrate impact back and facts. It is a really helpful tool. It's not the answer to everything, and we need to work with the data it gives us, with other data and other things, to get really quite robust actions, which I'll come on to on the next slide. And we've got a steering group, again, just like with any networks, and technically it's a LIFT network, I guess, because it is a mixed bag of colleagues and partners and organisations to ensure, one, that we're making good decisions about what we're doing when we can see those insights, that it's meaningful, but also that it goes to the right place and the right partner, pulling it right back to our inequalities plan. What can communities do for themselves? What do they need our help with? Where are we going to see this best work? And to Siobhan's point, who should be doing this, and understanding the mix of that work.
We've got 2 current main live campaigns, although, as I think Graham's going to allude, the LIFT tool is being used in different ways as well. And we do track all of the campaigns, mindful that some of this data is quite sensitive. So they all report into one space, so we've got a good sight of that. But the pension credit and the free school meals, and the pension credit, of course, has become increasingly important just in the last couple of weeks with the announcement that that's going to now be a key trigger for the winter fuel payment going forward. So the winter fuel payment campaign, it says there, it was announced that the winter fuel allowance will only be to households with the means tested benefits. There hadn't been a cut-off date when I did these slides. There has. It's the 16th to the 22nd of September, so we've got a bit of a time pressure. And that means that we need residents who are entitled to pension credit signed up and that application processed. One, so they get the pension credit, which is worth around £3,900 on average to households. But then on top of that, they also can be eligible for the winter fuel if we have a cold winter. So you can see, the pension credit we've talked about before, but there's also those wider benefits around winter fuel costs, rent, and if my Citizens Advice colleagues were sitting next to me, they would say they want to talk to people anyway. So what we're doing is we're building on the targeted pension credit pilot, which was direct dials to people who we believed were eligible in the Alnwick area. And we're going to do a data-led campaign. I say going to, we are. It is in progress. Next slide. So what we've done is we're in the process this very week of co-developing that information and social media campaign that includes also those hard assets that can go into places where people can see them. It's data-led awareness raising, so where we know where the families are. The LIFT tool has told us where the households are, where there's eligibility, so making sure we've got a real presence of this information there. And in those places as well, both Citizens Advice and our MEC Financial Wellbeing lead, Sarah Harvey, is out making contact with the key organisations and partners who are in those spaces where we know and saying, would you be interested in a conversation? Do you feel confident in talking about money? Or saying, is this something you've thought about? And really that soft approach and confidence building. And then from that we can update and monitor the data uptake, because it takes 3 to 4 months actually for the data to follow through on the LIFT tool and also for the applications to process, hence the September deadline. But we can monitor and we'll be able to report back and see what actually uptake we saw based on that. And we'll keep repeating that until we see the entitlement fulfilment that we want. At the side of that, I've some examples around the pension credit socials that have gone out already. But what's really important, going back to that partnership and network, and the LIFT meeting is next week, and a core part of this is to develop that whole programme of work, that project, that uptake campaign together, so that the assets we develop make sense. Citizens Advice gave us some really interesting learning about talking over slides rather than just slides, and how targeting family members rather than necessarily the people who would apply, all of these bits, and what wording works well, what gets most traction. Data is incredible for telling us who clicks through when it's this colour even. We ran recently the national campaign, the gov.uk campaign, and our own locally developed one to see which one got most clicks through to the application, and we use that information back and forth for greatest impact. We also have the free school meal uptake campaign, really important aspect to this. So having the appropriate legal and information governance support at the front end of this work is so important to see what can we do, how do we do this, and especially when we're doing targeted approaches that are household level. So when we managed to get that all clear, what the language was, what the legal basis for what we were doing was, how the sensitivity of the letter and so on, what the data processing, all in place, really great to work together across the system and have that buy-in and also learn, to enlighten for all of us. Then we did the data match for the entitled households, and the direct letter to the entitled households went out at the start of this week. Before the end of term, there was some work done with schools and communities, again using that data. Where do we need to know that these letters are going to land? Who needs to know, just in case somebody turns up and says, I've had this letter, what we're going to do about it? And then residents can object to saying, actually, I don't want to be enrolled for this. I might be entitled, but I'm not interested. And there's a time period for that, but actually they can object at any time. But to that point, it will be processed. And then the eligible children will be enrolled ahead of the October census. Families are advised. And there is a household saving. I've put on there, it's approximately £480. But on top of that, that also brings significant investments into our local schools. You can see those numbers there. And this exercise is worthwhile. I'm not going to go into the specifics of how many families and how many children, but it's very worthwhile for Northumberland. I'd be glad to come back and report on the impact of that at some point. So the final point on our approach, that place-based resilience building, so that information and support, which I keep going back to, but there's also the thing about people being able to access support. And in Northumberland, we have an interesting geography for lots of hubs. We haven't got one central hub and so on. So we have the community advice model in partnership with Citizens Advice, which is training and support for existing staff in place. So it may be that I work in a family hub, and I'm the person who's there in the breakfast time and so on. Training and advice from Citizens Advice to use their systems to be able to offer really good, robust advice in place. And that's working well. You can see the gains that are there. We've also been piloting that in primary care, and you can see those numbers again. And going back to that wellness, you know, when people are presenting, why they present at a primary care setting time and time again, if there is a financial thing, how are we working through that at that point when they're in that space to start that process of getting that support. Similarly, the community advice is the welfare rights at the school gates with North of Tyne funding, and you can see the numbers to that, and actually expansion that's continuing on into this coming year. So we're seeing more of that and more schools taking that up. And it is a confidence and a partnership thing. It's a step away from the day-to-day job in some ways, but actually these colleagues in the community are having these conversations anyway. All we're doing is saying what will help, what will scaffold, what will make you feel confident, how do you want to refer quickly so that that can happen. And also it's safer because we like talking to the people we trust and know, don't we? So we've got the Money and Pensions Service National Debt Advice Helpline in Ashington, which is a great thing for us. So that, you know, that's the national. So when we report on our debt management in Northumberland, it's much greater than just our Northumberland debt. So if ever you see a really scary figure in that, that's why that makes sense. But ours is at 6 million. But that's really important. So that's bringing best practice to Northumberland soonest, and also means we're influencing the shape of the national policies around the Money and Pensions Service and the hardship support. Make every contact count. I've mentioned that. So not only does Sarah go out and about and do the listening, a lot of the eyes and ears and building that confidence, but she also is delivering training and looking at those other opportunities like Talk Money Week, which is coming up in November, the Better Health at Work Award. How are we feeding financial well-being through all of this? And what are we hearing about what's working really well that can help us shape? We've refreshed our welfare rights training, particularly with our VCSE, by pulling all these different partners together in a room and say, well, what about we do it together? So you have MEC out doing training, and we've got our welfare rights team doing training, and we've got Citizens Advice doing, you know, how do we do that? And then combining that with lift data at a patch level. So when we go and do training, for example, in Berwick, and we usually focus on working age benefits in that training, actually, the majority of entitlements here are around this age and the visa. So the training can be shaped around that. So it's almost like additional embedding. That's the lift tool for local context. So in terms of next steps for this work is to continue to be strengths-based. So working on what we've got, working together and learning from each other, keeping that open and dynamic approach to testing and learning, but also tracking back and making sure it is doing the work and not just talking about the work. Insisting that hardship support and community resilience, that, you know, we need to be tying together those things, that when somebody is in touch with us because they need hardship support, what's the next step, what's the follow-up, and making those other opportunities, like for example the warmer homes and the employment pathways, tie. And again, that comes back to networking and knowing each other well, tracking the insights of what works. I've laboured that somewhat, and going forward, reviewing the approach that we've got and what's working against that framework. There's a superb toolkit. It's a fairly lengthy document, but it's valuable to see what have you got and to start, find out where we really are across those 5 initial measures and see where are our priorities and where do we want to be in a year, where do we want to be in 2 years, and really getting a hold of that. Thank you.
Thank you, Emma. Thank you very much. I think it's a very good raising awareness about pension credit and everything is critical for this year, given the announcement that winter fuel is going to disappear. It's not going to be universal. Yeah, so thank you. Are there questions? Yes, please.
Thanks, Emma. I think I've had too much coffee this morning. So. Going back to the data, so I'm looking to Ross, and I'm thinking, with your information, how do we identify those with fuel poverty or in that group who've had a hospital admission within the last year? Because would we be better picking that group for an even more intensive And I'm looking to Neil and thinking, well, where's the data that tells us who in that group is receiving home care? Because they're the cohort that if we were looking to maximise the resource in our system, we should be really picking them off and saying, what can we wrap around these people? Because we know these are the ones who really we could make benefits. And then if we can reduce the number of people getting loaded in an ambulance, taken to the hospital, our waiting times in A&E reduce, we reduce the pressure on hospital discharge. And again, it comes down to what are we doing with our analysts to say, where do we combine these data sets? And you could argue the same for the families in poverty. Which of those families have got a child in the house that's been admitted to hospital with asthma in the last year? Because they're the group we really need to get at as well. So this is really, I think there's a real challenge that we have to crack here, because we know all of these people, but we're just not good at finding them. Yeah.
Ross? Yes. Good. You? Okay. You want to give?
Sorry, I don't know. Our own health inequalities board internally within the trust looks at a lot of these really complex calculations and really, I know Alistair and colleagues really analysed the data, and Jonathan Stoddard-Pearson, who runs that board for us, and they've made lots of surprising finds and things that have opened our eyes to some of this, but I'm sure they'd welcome a conversation about integrating some of this data as well, because it's really useful stuff and very pertinent to what we're trying to do through our own programme over the next few years. So yeah. I think you're absolutely right, Graham.
Thank you. Any follow-up?
Just a further follow-up, and I'll look to Neil, we need to take this offline, but coming up in coming months, it'll be pertinent to bring Communities First into this forum to have a wider discussion, because exactly what you're describing, Graham, is happening behind the scenes in relation to that data collection. So there is actually a workshop on the 22nd of August with the National Innovation Centre for Data, just to explore what can we pragmatically do, because what we don't want is to continue to theorise over this and be really academic over it, because I think we've been there for the last 10 years, if I'm perfectly honest. We need to land this, and I think we've got a very solid start with the low-income family tracker tool, layering in the likes of blue badge information and system bid collection and such like. That's slowly creating that triangle of vulnerability for us, and we are starting to test that proactive outbound calling approach to work with people who are identified earlier, to intervene and support earlier, but we're at the very early trial stages of that. But I think that's the thing that we want to probably socialise with this group over the coming months.
Okay. Can I just come back on that for a second? Thank you. I think that's great, but as a system, we need to decide what are the interventions that we're all willing to invest in to the gain of the system. Yep. And that's where we need the really senior leaders who can re-divert their resources to say we'd be better off putting this in here. Now we know who we should be giving it to, using our resources on, or we go back to let's remember we only do what we can do as well. So let's not jump into the response of it'll be a provider response to this. It's what can we do in our communities to actually make a difference as well.
Right. Thank you. Derry, you have been waiting. I thought you were going to add to Graham, so Ross can answer both of you together.
That's
so
okay.
Now you are coming. Okay.
No, thank you. I'm really pleased this conversation has been around some of those health costs, because I think from the Health Watch perspective, one of the things that we are starting to hear about more is health costs as an unexpected cost and that unexpected bill. And it's around those things and those services and those treatments that are on the face of it, they're the small things, but they are the big impact things that we all know about, that if they're not done, then people get isolated and then everything else transpires from that. But they're also the thing, I mean, they are the small things we're talking about in terms of services, but it's like earwax removal. People are now having to pay £65, £80 a time to have that done. Well, that's not going to happen, is it? If you've got all the rest of it, and we know that. If you then put start to looks, we're starting to hear about podiatry in the same way, and dentistry we all know about. So these are the real life lived experiences that won't necessarily be picked up by some of that data because they're not part of that system. And it's also one of those issues where unless we do the income maximisation, then some of these people won't be able to do this because these are going to be the people that maybe aren't going to be eligible or just fall outside. So it's really important that we know that those things that aren't necessarily going to show up in the data are still heard, and that's why the flow of information around our networks is so important, so that, you know, we and others can feed that in about those very real issues that people are having to deal with and make decisions about with their income.
Thank you, Derry. You want to answer that, Emma?
Yeah, I agree, and I think that one of the key aspects around the data as well is that when people are asking for small supports, for us to hear what it is that those are for, and that's a really important piece of data. I mean, you know, when Frontline was first, one of the lovely things about Frontline is you can see what people search for that we don't have an answer to, and one of the things that always comes up is toenail clippings, and that's to your point, you know, and then you have sore feet. And then you don't go out, and then you've got to do, so we need to be in the detail of the work, but that needs to be data that we then can say, actually, this is a real core need for us. You know, it's transformational at that earliest point, Derry, you're right.
Jeff, you wanted to come, yeah.
It's really sort of a question for Jill, I think. I'm a little bit confused about free school meals business and it's where we need to do it, we need to help those people who actually need to. What are we currently doing in Northumberland in the way of free school meals and summer holiday meals? And what is the government saying that we have to do differently? And if we're starting to look at pensions to people who only need to have the pension, are we looking at the same way at school meals and only giving school meals to those people who need the school meals? I'm just confused by the whole thing.
I'll defer to Emma for the detail, if that's all right, Emma.
So free school meals is there's a threshold of low income that you become entitled to free school meals, and you have to apply as a household. You have to apply for that. And in Northumberland, we've got about 10,500 children who are eligible for free school meals at the moment. What that means for them individually is they go to school term time, and there's other bits around if they're off school and things, but generally they get a hot meal to a standard. What we've had in recent years, because we've had the Household Support Fund, is holiday payments as well, where families have had, who are entitled to free school meals, have had the equivalent value for the 6 weeks holidays in a voucher for their local supermarket. But free school meals also, it provides funding for schools, for each pupil that is eligible, so it's worth schools' while as well as well for the families, and they use that funding for things like extra support for children or breakfast clubs or different things that just make it easier for children who perhaps from less advantaged backgrounds to do well. So it's a really important field of money. What we're doing with the campaign is we've identified that there's a quite a high number of children and families where they're not claiming, even though we believe they're entitled. One, that's important for the children themselves and the families, but it's also important for the income for the schools. And it, you know, for lots of good reasons, and it continues on beyond the year. There's a formula to it and so on. So we're doing the campaign. Usually schools do their own local campaigns, or parents will apply themselves because they'll have seen it, but we're aware that that's not at the where we want it to be in terms of take-up. So that's where that sits. There are children who, and then of course the Holiday Activity and Food Programme is directly linked to free school meals as well, so the number of places that we're able to offer comes directly with that. So it brings further investment, but most importantly it brings resource to families and households so that they can do well. With regards to the pension credit, you know, again, that's an income-related entitlement, which is the passport to what we know now from this year is going to be the winter fuel payment. So when it's cold, where people get a payment into their bank account directly for so many consecutive days of cold weather. And we know we've got older people who are eligible, so they're on a low income and eligible for pension credit, but who haven't applied, they haven't made that application. So we're just seeing both of these cohorts. This is here. You know, we think that this may be something you're entitled to. Is there some way we can support you to access that? Because it's worth it for us. And it's worth it for us at a household level and at a community level and at a street and spend level as well, to bring that money into Northumberland.
Just clarify one point then. I thought I'd read that free school meals for everybody was what was for every child. Have I got that wrong?
So there's universal infant free school meals. It is quite confusing, apologies. So children in reception in year 1 and 2, excuse me, my children went to school in Scotland, I'm pretty sure that's right, the first 3 years, yeah. Then they get a free school meal. It's unfortunately used as the same term, universal infant free school meal, but that is not a means tested benefit. So even though they're getting that meal, which is great, it means that we're not getting the additional value either for the holiday activity and food or for the individual award to the school per child that's eligible, but they can still apply for free school meals. And it is quite, you know, it is tricky really. So you've got children that are getting meals in families, say, well, they already get the free school meals, but they haven't registered for the other stuff that comes with it when you're part of the low income component. So it is confusing, and
Okay. Thank you.
You want to add anything? No. Okay. I think I understand you, Jeff, your question actually, because again, there is no very little comparison between free school meals and pension credits. So these are two different. We are targeting two different audiences, basically. Yes. Yeah. Thanks for the clarification, Emma. Yeah, I saw. Yes, Neil. Yes, that's right.
Thank you, Chair. Yeah, I mean, brilliant report, really important area of work. I mean, we're very focused on that in adult services as well with our financial assessment benefit officers and having our own welfare rights service in there. As I was reading through it, there's some really important building blocks in there, and it was fascinating. The one bit that I was expecting to see more of, though, but I only spotted in the second bullet point of next steps, was the mention of employability. And that is the key route out of any poverty trap, financial difficulty and things like that. Often even for people who feel like they're unemployable, but may actually be employable in ways that they haven't thought about yet. And I'm thinking particularly for the focus of our work, trying to capture that group, people with disability, people who are aging and things like that, who may feel they're out the system, but they could be in the system. And I probably just would like to see a little bit more, a section on that, and a section on what we're proactively doing. I know it's picked up in a lot of other areas. I know it's picked up through education. I know it's picked up through government departments as well, pushing employability, DWP and things like that. But it just feels like it's a huge element of what we should be trying to achieve here. And I'd love to just see that bolstered a bit in any refresh of it or something like that. Yeah.
I think it's a really well-made point, Neil, and I think the beauty of this network is its newness, actually, of it coming together, probably a bit less than a year, is it, Emma? And it came about purely because we were aware of the amount of great work that was happening, but pretty scattergun, and we weren't coordinated, and also the risk that comes with that is that people didn't know what they didn't know, so trying to pool that together has been the first phase, for want of a better description, and I think as our maturity grows, and we've got a framework to hang it on, then employability will link into that. But you're right, it does happen elsewhere in a really substantial way at scale, but it's that connectivity that we can pull through as the network matures, and the structure and process of it develops into a bit more of a tighter action plan. So good point, well made, Neil, thank you.
Yeah, thank you. Yes, Wendy. Yeah.
Thank you, Chair. Emma, there are people who live just above the pension credit cap, and they will miss the winter fuel allowance without question. So are we as a council, via our local coordinators, our local community officers, will we be promoting the warm hubs much more so that people at least can go there? Because I think this is a real concern.
Absolutely, yes. The warm spaces and all the wider information. And I think as well, I'd mentioned that the push of citizens' advice to make this a wider campaign rather than just pension credit, because as with the low income, when you've got a threshold, you've then got 10 to 15% above that, which is still low income.
Yes.
So it's really important. We've got thoughts, plans, connections, and so on, and we're using the best if we've got. So absolutely, yes.
Thanks, Emma. It is a huge concern, but an excellent report.
Thank you. Yes, Jeff, finally.
Just to add to that, Wendy, just to reassure you, the 33 libraries, the 10 leisure centres are already looking at warm hubs again for this year, and fully understand the situation and expect people to come in again.
Thank you, Jeff. That's a good suggestion. Any other questions? Yes, please, Mark. Yeah.
Thanks, Emma. That's. I mean, thank you and your team for all the good stuff you're doing, and Jill. It is a massive issue. I cannot believe how much money's not kind of claimed and things like that. anything, obviously, as councillors, what we can do, but really what I want to ask you is, as the business chair of Ashington Town Council, will you come to our next full council meeting and speak to the councillors in there, so maybe we can get the message out a bit more that we're surgeries and local events?
Yep.
Maybe it's
Can
not
do
the
that.
next one, but the one after that.
Yeah, and you can let me know what you need. Yeah, of course.
Yeah, councillors can play a role as well. Most of them in Cramlington, we run Facebook, so it's a good idea. Yeah.
Thank you.
Sorry.
Just a final point, if I may, and it builds on Councillor Purvis's ask. In relation to the MEC work, this is about having structured conversations with meaningful content and making sure that what we don't give is misinformation in all of this, because we need to work within our thresholds of competence, don't we? And that's why we're being advised and guided by citizens' advice. That's why we've scooped up and we're working very closely with faith networks. So what our big ambition is for our workforce per se, but that would include elected members and leaders in communities, is having that ability to have the conversation themselves rather than relying always on topic experts to come in. So I think there is a piece around upskilling, and we always talk a lot about having health, social and welfare as core skills and competencies of our frontline staff, and who is it that's actually having an interaction with residents so that we can have a meaningful conversation and an effective signpost. So I think that would be potentially the tone of the conversation about bringing that in, about how can you then cascade that out.
Thank you.
Thank you. Right. There seems to be no other questions, so thank you very much, Emma. Yeah, and we move on to the seventh item. Sorry, no, sixth item. Health Watch Annual Report. It's a major primary source of information about the ground level information. Thank you very much.
Thank you, Chair, and thank you to the committee. This is actually our 10th annual health, 11th, I beg your pardon, annual Health Watch report, but it's my first because I only took over as chair just about a year ago. I've just been reflecting on all the conversations we've had. We'll come back to some of your points, Graham, as well, because I recommend you keep up the caffeine intake. It's given us a really good, stimulating first couple of presentations. This presentation would have come to you in July, and that's because our Health Watch year runs from June up to the end of June and starts again in July. But of course we had an election, and because we had the election, we couldn't bring it in July. We bring it to you now. Publication was delayed until after the election, and yet it falls brilliantly, doesn't it, with all these other items. And I don't think it would have mattered which meeting we brought this to, because there is a common thread of what we do. We're not going to go through the report in great detail. I'll hand over to Derry in a minute, and she'll talk you through what we've done over the last year or so, because that's what this report's about. And then we'll come back at the end to some reflections on where we go next, so the next steps. And there's, just bear in mind as we go through this, we see our role as amplifying the voices of residents of Northumberland, both users and potential users of health and care services. But we're very careful to avoid amplifying noise. We need, as part of that, to hear as many voices as we can, to filter out the real clear signals from all of the noise. We get a lot of noise about health services in particular. We don't get quite so much noise about care services, but we've tried to address that over the past 12 months, and we're going to try and do more about that going forward. So that's part of our role. We're a very small organisation. We have a very small team. We have a very small team of volunteers. So the challenge we have is focusing our efforts to the areas where they add the most value for the system as a whole. And we walk a very delicate tightrope as we do that, because we have to maintain our independence from the organisations. We need to speak truth to power, but we do have sort of statutory roots into each of the organisations, so we can feed those voices into the rooms in which decisions are made. That's all I'm going to say for now. We'll come back, and I think we'll pick up some of the themes that we were touching on earlier on as we go through.
Thank you, Peter. My presentation, that's lovely. So the national theme this year was the value of listening for the Health Watch network, the 152 across the, across England. And I think it should just be our theme all year, every year, because I think that is basically what we're here to do. So I thought I'd start off just by reminding everyone about what Health Watch is and our core functions. I hope that's not me. Good. Just about our core functions, because we are a creature of statute. We were created by the Health and Social Care Act in 2012, and the subsequent changes have added to some of the things that we're here to do. But the things that are on the slide are basically the things that we have to do. That is why Health Watch exists. In statute, these are the things that we have to do, and we have to show through each year's annual report that we are delivering, and everything that we do passes up to Health Watch England, and they have to report to Parliament. So there is that flow of information up through the system. You won't need reminding, but every local authority in England must commission a Health Watch function, not an organisation, a function. And we are very grateful to Northumberland County Council for its continued level of support. I know from talking to colleagues that that has not been the same in other places, so we are very mindful of that fact. And also a reminder about the way that we deliver Health Watch in Northumberland, that is delivered by, under contract by Adapt North East, and that's the organisation that is contracted to the council and who we all work for. And the model that Adapt North East has developed is actually recognised as one of good practice through the Health Watch England network, because what Adapt North East have done has put a board in place, which Peter now chairs, which sets a strategy and an annual operational plan with priorities. So there's a flow and a logic to how that all works. This year, I have to say, has been the first year where we've also seen support from the Integrated Care Board, and the ICB has formally recognised the importance of the Health Watch function by supporting the Health Watch network in the North East and North Cumbria, meaning that there's additional resource for each of the 13 local Health Watch. But more importantly, almost, I can't believe I'm saying that, but actually more importantly, a seat at both place, or whatever we're calling it now, ICP level and at ICB tables. So again, it's really about the Health Watch network being in the right place to have those conversations and to amplify those voices. And again, something that colleagues from the ICB might want to know, but what has happened in the North East and North Cumbria as the biggest ICB is recognised nationally with the way they work with Health Watches as good practice. And I think has come about with a relative ease here that hasn't been reflected in other places. So again, just a reminder about who we are and why we are. So let's have a look at what we've actually done. Turn the wrong one off, too many buttons. Right, so 23 and 24. There is a prize, obviously, if you can recognise all the photographs in our annual report. Hopefully you'll have all seen our annual report and had a chance to look at it. But basically the annual report shows how we have fulfilled our statutory functions, and obviously we're happy to answer questions on any of the work that we've highlighted. Just going to pull out a few. I particularly want to highlight the work we did on health visiting, which shows, I think, the importance of listening, as I said right back at the beginning, because that wasn't necessarily a piece of work that we had on our agenda probably 18 months ago, but we did a piece of work in Blythe with parents, and we started to hear stuff about health visiting. And then when we sort of discussed that as a team, and then we started realising we started to hear it in other places, and that project grew organically out of that. You'll have all seen the report, and if you haven't, it's available on our website, and I'm happy to send you copies. And we're obviously been working with Harrogate and District Foundation Trust, who have come, been very good about the way they've reacted to the report and are putting together an action plan. And we're waiting to see the final action plan and how that's going to be implemented. And I would really encourage the Health and Wellbeing Board, Health and Wellbeing Overview and Scrutiny Committee, and Children's Overview and Scrutiny Committee as well, to actually work with us on monitoring that report, because I think there were some really interesting things that came out, and I think Harrogate and District have been quite, as I say, so fulsome in the way that they've reacted. But I think there were some very real things that the people of Northumberland and the parents of Northumberland said they wanted to see. Just on that point, I think it's probably worth noting as well that our colleagues in North Yorkshire, another large rural county, have also just published a report on the same issue. And obviously with the crossover with the same provider as well, it's interesting that the same issues came out of their report as well. So although, again, it's that thing about the power of network, so it's just not Northumberland, other people are saying the same things as well. And again, that's probably worth you all just being aware of. So we have, I think hopefully in the report, I think we've shown that the thing that we need to do, our core function, is to influence. And it's always tricky and timescales can be lengthy. And that is why when we do get quick responses, we are so happy. There's almost bouncing up and down in the office because it's just lovely. And I think certainly this year, the response that we got from NHS England about the vaccination communications was an absolute example of that. That was a matter of, I think it was a day or something where that really changed and we were able to get information out. And you saw in the report the patient response to that. And I think, again, when we really feel that there's been engagement and there's been a coming together and we've been able to be part of, bringing people together to solve problems. It just feels like that 6 people sitting in an office in Hexham, we're not because we're always spread out across the county, but can actually make a difference because we work with others. And I think the work in Long Houghton and Harbottle absolutely epitomises the importance of that and that working together and that importance of engagement. And I think both communities spoke up in those areas and we were very pleased to be able to work with them. And we commend both Northumbria Healthcare and Alnwick Medical Group for listening to what those communities were saying. And I think that's just, that was just a really important thing for those communities to happen for those communities. I think it's important to note at this point that although we always frame what we do as a Health Watch is that we are here to influence, to improve care more and more, and that means that what we're hoping to do and helping to do is influencing to maintain or not see a deterioration in care. And I think that's quite an important issue for us and maybe all of us in this room to think about, because that is going to be something that we probably is not going to go away. We are pleased that our cost of living leaflet was taken up so enthusiastically by many groups and agencies, and part of the discussions today were all about that. We are in the third reprint of it, and we're delighted to have been supported to produce it in 6 community languages, which again was something that we heard from when we were engaging with different communities in the county who said that they didn't always feel they had access to information, didn't know about services. We thought, well, this is what just needs to happen. There are 2 key reports that are just about coming out now. We've had to delay them again, as we said, because of the election period. And I think these are 2 important ones. And I would encourage you to obviously read them, as I would for anyone. But I think also keep one of them particularly, if not both, handy for, and I look at elected members here, handy for surgeries and things like that. One is about the different new and additional roles in primary care. So what the document is trying to do is trying to demystify and help inform people about what roles are there and why they're there. And the second document is reflections on how to raise a complaint if you have one. Now, they are both hard things, and we know that. We absolutely know that. But what we've tried to do with both of those pieces of work is bring some positivity into the area and to the issue. So bringing to you service providers, commissioners, decision makers, the real experience of what people are saying about primary care or making a complaint, but actually saying, but this is the way that it can be, this is a way of actually helping resolve the situation or helping not to make it get worse. So they'll be out soon and happy to talk about those in other places. I really want to talk about our volunteer group because, as I say, 6 people, not going to cover the whole of Northumberland, but our volunteer group is growing and deepening their involvement with us, and having done the required additional training, they are about to embark on a series of enter and view visits to 3 care homes in the county this month, starting next Tuesday. And all 3 of those reports will be obviously public documents and available from September onwards. But again, I think that's a really important role, and we've had, you know, really good response to the training and people wanting to get involved around that. And our volunteer, you'd have seen our young volunteer in the report, talking about why he wanted to volunteer with Health Watch, even though he's still at school. He's in Cramlington this morning. So he's out in Cramlington listening, he's in the hub listening to what people have got to say. And we are also working on a new idea about how we can engage with the high schools and get more of the young people to be Health Watch ambassadors in their schools. So again, I might be coming to talk to people about how we might do that. So that's sort of a bit about what we did last year. If there's any questions on any of the other bit, anything else in the report, happy to talk about that. But I will move on to next year. So what will we do next? Well, when I say next year, I mean the actual year we're doing now. So we're a month, 2 months, well, month and a half into it now. For the coming year, we will continue to do what we do. We're keeping on. So that is things like our online sessions, our hear-to-hears, which are our drop-in sessions, our monthly reports, which hopefully everyone in this room is signed up and gets that. That is your sort of monthly temperature taking of things we're hearing. So it's, you know, word on the street, if you like, every month. Obviously, we'll be tweaking those things as we go along, but we will be continuing to do that. The other piece of work that we're very excited about is we will continue to develop the Adult Social Care People's Panel, and we're looking for additional members for that. I think it's been one of the most enjoyable bits of project work that we've done, and I hope Neil feels that it's been valuable to him and his staff. But again, if anyone is aware of anyone who's receiving adult social care and feels like they would like to be in a room and, you know, having useful, productive and positive conversations about how Neil and his staff go on, then please put them in touch with me and we can sort that out. We will work on issues raised by the public in our annual survey and through engagement. You'll have all seen that in there, that there are some key issues in there. Audiology is one issue that just keeps coming up. Pharmacy, all of those things, and care at home. They're the 3 things that people said from our annual survey they wanted us to work on, and that's what we're prioritising. However, we will also be working with the 12 other health watches in the North East and Cumbria, so that a combined voice, as I said, is heard at our highest levels. That will be across a whole range of issues, things that we might not have thought of, but again, it goes to that fact that the ICB recognises the importance that Health Watch as an independent amplifier can bring to its work, and we're very happy to help them with that. I will probably hand back to Peter at this stage to talk about the last bit.
Thanks, Terry. I think one of the other things we'll be continuing to keeping on with is the building of relationships. It's closing together or bringing together all of the networks. We heard a lot earlier on about the various networks that exist across the county. Each of those networks is in contact with people out there who've probably got something to say that we're not hearing. We're particularly aware that it's not just about hearing more voices, it's trying to hear the voices in those communities, not just of place, but of interest and experience and all those other things I keep harping on about, that we're not picking up. And now somebody out there in the networks that work really well across our board is probably hearing something. making every contact count fits into this framework, as we were saying before, as part of the foundations. If it's a mindset of making every contact count, we are here to hear. So if messages are coming through your networks that you think might not be getting appropriate attention, then by all means pass them on to us, and we will pass them through our filters as well. So hearing is important, filtering is important, and targeting our limited resources at those things that can add most value to everything we're trying to do strategically across the county. Now, we've picked out in our report those 3 things that have come to us from our listening exercise. They might not be everybody else's priorities, and we're very happy to build on that. We have a really long list of other things that we debated whether we make them a priority or not, and we will tackle them, perhaps opportunistically, but as funding and sort of experiences change during the year, we have some capacity to add on to there. But we want to make sure we do that in a way that's adding most value to the system as a whole. We're a kind of listening network, and we're an information giving and sharing network. We can add value. We're a very small cog in an extremely big machine, but we are a cog that can help to bring qualitative input into that sort of data scenario we were talking about before, so that we get both the qualitative and quantitative evidence into the rooms where those decisions are made. That's what we're very keen to do. We can't do it on our own. So we thank you all for the support you've given us the past year. And that's more of the keeping on that we want to be doing this year. Happy to take any questions.
Thank you very much, Peter. Thank you. Are there any questions, suggestions, helpful remarks to Northumberland Health Watch? Yes, please.
I think it's just really to update Health Watch that the actual report and the action plan goes to Harrogate and District's Children's and Community Board next Thursday. Then we will be in touch with regards to our action plan. For me, it was really positive. The report, I saw some real positives there. The action plan is very positive in terms of some of the areas of concerns or suggestions. We've actually already implemented strategies such as our single point of contact, Health Watch, around being able to access our service. We've realigned our health visitors around consistency and continuity for clients, for partners. So there are elements that have already been achieved. So that's really positive. Thank you.
Hi, just to publicly say thank you, especially for the input to primary care that you've had. And as you were going through your report, I'd written down, I need to catch up with Derry about the discussion she had at the LMC about how do we engage with our population around the changing face of general practice. So to hear that you've got those things ready to come, so get in touch and I'll help you work that one back through primary care, please. And I know Hillary's not here today. She sent her apologies. But she's been a key person, I think, in working with you on that. Yeah, thank you.
Okay. Any other? Jim? Yeah, please.
Just to support what Ashley said from the health visit and perspective, clearly we work in close partnership. The report did come through our Healthy Family Partnership Board as a collective. We have discussed that as well. So, and then it was over to Harrogate to develop that action plan, but it's absolute partnership working. And similarly, it was encouraging what was in that report and also achievable what some of the recommendations were as well that were coming out of it. So there wasn't anything that we felt that couldn't be acknowledged and addressed.
That's really helpful. We do work hard to make achievable smart actions. I might come back to you and get the details of where it's being, because that's always good. Thank you.
Yeah, I mean, it's going to be a lot of thank yous here. I mean, we have an excellent relationship with the two of you, and Derry, the work you do with us is really, really appreciated. I mean, I've just spent a week going through a CQC inspection and been grilled on co-production, and I think we've moved way beyond feedback now in terms of the relationship, and most public sector bodies now are under a lot of pressure to enhance the way that they involve people with lived experience into development policy, development strategy in the decisions we make. And I mean, you mentioned the advisory panel that you've assisted us setting up with, which is now a key vehicle on our journey to co-production. And I think we'll be racking our brains on other things that we can do and wanting to involve you in that, because it's just much appreciated. And it's given us a really easy route into hearing that voice properly. So long may it continue. So,
I think that's a very good point, Neil, the co-production and working with the Northumberland Health Watch. I think in the CQCU panel interview, they asked me about how we are going to scale up, make every contact count in the MECC. and what kind of a training. So I gave them some answers. So that's being looked at. Thank you. Are there any other suggestions, questions? In that case, we will move on. Thank you. Thank you both. Yep.
To the general public at our annual general meeting on the 23rd of October. It's going to be held in Berwick. Key organisations will be getting invitations if they haven't already, but there's an opportunity to connect as well. Thank you.
Thank you, Peter. Thank you, Derek. Right. So item number 7 is a forward plan, and it is there in the agenda. If you have any suggestions to make, please email Andrea. Jill, you want to say anything?
Just to note that it's a closed meeting. It's at the September meeting, so it's with the Institute of Health Equity. I think we're going to be at River Green again, where we were the last time. So it'll be ourselves plus our additional subject matter experts. So the agenda will be coming out in due course for that.
So the topic is going to be deep dive.
It'll be
on
about the county
housing.
partnership and the inequalities work that we're undertaking with IHE.
Yeah, thank you. Thank you very much. And that brings us to item number 8, urgent business. I thought I would kindly invite Kevin Waring, our representative for the Northumbria Police. First of all, let me say all the police forces and the uniformed forces, fire, they are doing a splendid job in the recent days when some people seem to have gone mad. Thank you very much for all the things you have done. And if you have a few words to say, Kevin, please, you are welcome.
No, thank you very much, Chair. I think the first thing to do is to say thank you to everybody. I think everybody has played a really, really big role in trying to put a stop to this absolutely awful behaviour we've seen on our streets. And I think that public support yesterday, you'll have all seen on media, was really, really powerful. For all police officers, for the public, for all communities, it was so great to see that unity come together. The community tensions have been incredibly high, and in 23 years of policing, I think go back to 2011, we saw some riots and protests on the back of a shooting in London. I think tensions on this occasion have been even higher than that. It's been really, really significant. It's been incredibly challenging for everybody, all the blue light services. Northumberland County Council have played a really big part through the Strategic Coordination Group and all the groups linking into the communities. We've been sharing lots of information and intelligence. We've been working with our community engagement teams across all the organisations and getting into the key individual networks. We've been getting in touch with our vulnerable communities as well. And I think local councillors have been updated as well. I hope you've had emails letting you know our key messages and how it's been going. What I can say from a Northumberland perspective, we have not, and touch wood, seen the levels of disorder that we've seen across the region and certainly across the country. And I would like to think a lot of that is testament to everybody's work and the public and everybody coming together. We've been in touch with our key leaders. We do have a mosque in Blyth in particular. There was little pockets of intelligence of potential disorder there that never materialised. The biggest challenge we've had as well in all this is misinformation on social media. And you know, we all have a big role to play in quelling a lot of those poor messaging. So what you can support us with, particularly the councillors, is following the key trustworthy media streams, the police, our colleagues in the main services to share that message. It's created a lot of tension and reaction. What we've also found is, and not wanting to single out young people at all, but there's been a lot of young people involved in this, particularly teenagers, 14, 15, 17. We're now going to start seeing some sentences locally. We've seen some nationally, and hopefully that will start to make people realise that, you know, the full force of the law will be there ready for them if they do affect people's lives in the way that they've been doing. There are further protests planned in Newcastle on Saturday. We're ready. All of the blue light services, all the partners are ready. If anything does develop, we will be there. We've been getting support from right across the country. We've had mutual aid from other forces to support us, as we have supported other forces in the region. So just finally, just say thank you very much. We're on it. We're going to keep at it until we get to some sort of state of normality, but it has been very hard, so thank you.
Thank you very much, Kevin. I think all the very best to you and all your colleagues. I'm sure fire office will, rescue service will also be stretched. All the best to both of you. Thank you. Thank you for everything you do. Is there anything you want? No, thank you. That's urgent business done. So date of next meeting, as Jill said, is going to be a development session on 12th September. Thank you. Thank you for coming. Have a nice summer break. See you all in September.